Hi everybody, welcome back to Tone Up on Thursdays with Tricia and Lindsay. Today we're going to look at something that was a very big concern for me when I first started working with Lindsay, and that was I had a tendency for my back to be curved at the top, so I was becoming very round-shouldered, probably because I spent an awful lot of time on my computer, and if I wasn't on my computer I'd be reading something, so I'd be looking down and then my shoulders were becoming very rounded. Now I know this as a Dowagers Hump, but you may find that terminology offensive, and if you do I apologise, but that's what we're talking about really, that tendency as we get older for our backs to become rounded at the top, and of course then your head goes forward and so on, so you don't hold yourself in a very good position. So Lindsay is going to take us through a 3-step process today in order to help us to make sure that doesn't happen, or to correct it, or to begin to correct it anyway if it's already started happening for you. So I hope you enjoy it, and I'm going to pass over to Lindsay now, who will just explain what we're going to be doing here.
Hello everyone, hope you're okay today. Thanks for joining us. So, rounded upper back, otherwise technically known as kyphosis. Let's have a look before we get into the exercise side of things as to how it presents and why. So if you just stand on the side, Tricia, and let's just have a look at what we're dealing with. So often, as you can see from how Tricia's standing at the moment, the chin will jut out to the front. So the head's fallen forward and the chin juts out to the front. In so doing, what you see is a compression into the back of the neck. So you can see that the back of the neck is shortening. Now, what will also probably likely happen is that the upper part of the shoulders, so across the top of the shoulders, will get tight and they lift up towards the ears, and the upper back will also round at the same time. So it's flexing forward. So you've got that lifting of the shoulders and the flexing forward of the back to create that rounded shape. What will also probably happen is you get an inward rotation of the shoulder itself. So your shoulder joint will sit forward, and you can see it slightly in the way that Tricia is standing. It's slightly rolling forward, which means that the chest has shortened as that's happened. And if you stand back to the front, Tricia, a good way for people to have a little look at what's happening with their shoulders is to stand in a mirror and just hold your arms naturally loose so they would normally go. And if you find that your knuckles, you can see them from the front as opposed to them being out to the side, then it's likely that your shoulders are probably what I call inwardly rotated, so come forward. If the palm of your hand was completely flat at the side of your thigh, then straight away that pulls your shoulders round to the back. So that's how it looks. Let's have a look at what's actually happening from a musculoskeletal point of view. So as I said, the back of the neck as the chin comes forward gets compressed. So what we've got is tightness in the back of the neck. And we've also lost muscle tone and strength in those muscles that hold the neck directly above the spine, so nicely aligned where we would ideally like it to be. So you've got two things happening there. You've got tightness in the back of the neck, and you've got the muscles losing strength. Similarly, if we look at the shoulder area, you've got the shoulders coming forward. So what's happened there is that the chest has shortened and tightened, and the muscles across the back, so the muscles in between the shoulder blades and the muscles that are responsible for holding them backwards have also loosened. So again, there's two things going on. One is about tightness in certain areas, and the other is about looseness and lack of muscle strength. We've also got the lack of mobility in the upper back and the thoracic spine as well. So we often forward flex and we don't move the spine in other directions that it's designed to be used. So we don't do a lot of rotating to the side, we don't do a lot of bending to the side. So as a result, it gets really tight and it gets pretty much locked into those kind of positions. So the solution, therefore, is what I consider to be threefold. So the first step would be about mobilizing the area and trying to keep it moving. The second step would be about stretching those areas that we've just seen are tight. And thirdly, strengthening those muscles such that they hold the body in the right position that we want it to be in. And why is it important to kind of look at that? Well, firstly, there's an aesthetic aspect to it. Nobody likes to kind of walk around with a sort of rounded back. And actually, they say that if you improve your posture and you stand tall, obviously you're not in that slumped position anymore. So they say actually you can drop a dress size by improving your posture and standing tall and correcting the upper back. So that's got to be an incentive in itself. I suppose the more negative side is that you can get quite a lot of pain from being in that position in the long term. You can get headaches, which is obviously not great. And it can also impact on your breathing. So if you think about it, when we're slumped down, our ribs are all kind of compressed. If you think about it, your ribs will have dropped towards your pelvis as that upper back drops forward. So that whole area is restricted. And if you think about the breathing that we've talked about in previous videos, where we need to expand through the rib cage and then contract it all the way back down, you're not going to be able to do that if you're in that rounded back position. So it can impact on breathing and therefore the circulatory system as well. And I think the other thing that is important to mention is that if you've got those kind of postural issues, it can actually impact on how you're feeling mentally too. You know, if you're closed down all the time, that can really make you feel a bit rubbish. Where if you stand nice and tall and you're open and loose, it lifts you, it makes you feel so much better. So lots of reasons, I think, to have a go at correcting these areas. Now, I would say, as an aside, that a rounded upper back can happen for other reasons as well, apart from just postural reasons. So if you feel like there could be any other issues, then it's definitely worth getting those checked out. There's various illnesses that a rounded upper back can be a symptom of, which I won't go into. But if you have got any other symptoms or you're not sure, then it is better to get it checked out. But if it's just posture that we're talking about, then what we'll do today will absolutely be helpful for you. So let's start on the mobilization side of things. And I'm going to work through neck, shoulders, chest, back with most of the things that I'll cover. So you'll get a mobility exercise for each of those areas. You'll get a stretch for each of those areas, and then later a strength exercise for each of those areas. Good. All right, so let's start mobility on the neck then, Tricia, please. So you're just going to take a breath in, out breath, look over to one side, back to the center, breathing in again, and over to the other side. So some of these moves will start to become familiar to you now. We've done them in quite a few videos, but that doesn't mean to say that they're not as important as ever. They will always be important. Good. So nice and gentle with these. We're not trying to stretch, we're just trying to mobilize. So we're just working on those vertebrae in the neck. Good, perfect. Back to the center then, take a breath in, drop the chin down onto the chest and roll it around. So just roll around from one side to the other. Again, nice and gentle, nice and easy, just while we warm up. That's good. That's it. So let's go 2 more each side. Beautiful. Good. And then back to the center. Lovely. Okay, so bring your arms to chest height. And you just palms in, and you're just going to open the arms. That's it. And then close them back again. So just starting to open up through the chest and work with the shoulder joint. So opening and closing. You can use your breath as you go. Out breath. And in breath as you come back to the front. Good, let's do 2 more of those. Beautiful. Perfect. Let your arms relax then and circle the shoulders. So take it through its full range of motion. So you're going up to your ears and then pushing it round to the back and down. And then the other way, please. Lovely. So I'd say about 6 to 8 circles each way, and then hold it there, Tricia. And you're just going to swing through. So front to back, swing the arms. Good. Nice and loose. Beautiful. And then hold them at the side. Take a breath in, and you're going from one side to the other. So a side bend, out breath as you go over to the side, in breath as you come back to the center. Leave the arms nice and loose. So breathing in and out as you go. Good. Lovely. And then finally, you're going to rotate. So nice, easy rotation from side to side, moving from the waist. So this starts to get the thoracic spine just loosened up. Good job. Perfect. Okay. So we're ready for our stretches now. So let's go back to the neck and we'll do a couple of stretches for the neck. So the first one, you're going to stand nice and tall, shoulders away from the ears as always, and a nice open chest. Take a breath in, full and wide, and then drop your chin onto your chest. So this is a nod of the chin. You're holding the chin on your chest and you're letting the back of the neck lengthen. So you remember at the beginning, we saw that the neck was compressed. It was shortened as the chin came forward. So by stretching it here, we're trying to get that length back through the back of the neck. So your chin with this one is pretty much down on your chest as much as it will without forcing. That's it. Good. And then lift the chin up again for me. And let's just go one more time. So nice big breath in and out breath to drop the chin. So this should feel really nice. If you have got neck tension, it should give you a really nice stretch up the back of the neck. I mentioned last week in the stretching flexibility video that around about 20 to 30 seconds in a stretch, but you can break it as we're doing. So we're coming back up to the top and then going back into it. So you don't feel the need to just hold it there for 20 to 30 seconds if it feels uncomfortable. Okay, so that one was about stretching the back of the neck. The next one is about stretching the side of the neck and the top of the shoulder. So you remember we talked about the shoulders lifting and you can feel the tension into here. It's a really common area to feel tense. I certainly get it and it really gives me headaches when it's bad. So to stretch that out, we're going to take a breath in again. And this time, leaving the shoulder back and down as always, so don't let it come with you. Tilt your ear toward your opposite shoulder. And straight away, you should feel that that stretch has moved from the back of the neck and it's going all the way down the side of your neck and out to the edge of your shoulder. Can you feel that stretching, Tricia?
Yeah, I can, yeah.
And then come back up to the top, take a breath in, same thing the other side. So you need to make sure that the opposite shoulder stays down, don't let it come with, because if it's tight, it'll want to lift with you. So keep that down and pushed away to the back and then gently send your ear towards the opposite shoulder and breathe. Perfect, good, okay. So that's 2 stretches for our neck area. The next bit that I want to look at is the chest. So for this, you can use a door frame, but here for Tricia, we're actually going to use a little bit of wall because it can sort of, it replicates the door frame. That's it, perfect. So you're going to put your lower arm on the side of the door frame. It is possible to do this with both arms together. If you imagine, you know, you've obviously got 2 sides of the door, so you could put both lower arms on the side of the frame together, or you can do it as one arm like we're doing at the moment. So it's entirely up to you. Now, let's just get the position first of all. So you want your elbow, I would say, around about level with your shoulder, but not too high. So kind of between your chest and your shoulder, that's it. But in so doing, definitely don't allow that shoulders to lift, because if the shoulder lifts, then we've got tension going on again across the top of the shoulder. So keep the shoulder blade anchored down and just get yourself in a nice, comfortable position. That's right. Now, what we're trying to do is to stretch the chest. So we're going to take a breath in, and on the out breath, you're just going to lean your body weight forward. I appreciate with this angle of the camera, it's a bit hard for you to see, but Tricia's just leaning the body weight forward, just as you would if you were using the door. And you should feel, as you do that, a stretch across the chest. Can you point to where you're feeling it, Tricia?
Yes, I'm feeling it across here, and then obviously quite a lot of in my shoulder joint. And yeah, good. So it's I would say it's particularly on Tricia's right side where she should be feeling it. I wouldn't necessarily expect it to go right across to the other side, unless of course you're doing 2 arms at once, in which case you probably will feel it across the whole chest. But if you're just doing 1 at a time, I would expect you to feel it just in that side that you're stretching. And if you think about it, there's muscles that attach to the top of your arm from your chest area. So they go across that shoulder joint. So those are the muscles that we're trying to stretch out here. That's it. Perfect. So same thing with that one. You're using your breath. You're trying not to tense anything. Keep the shoulders relaxed. If you want to come out of the stretch and then go back into it, please feel free to do that. That's totally fine. You don't have to hold it really, you know, for 20 to 30 seconds full on. Just break it down if you need to. Now, we can't really do Tricia's other side because you wouldn't really be able to see it very well on the camera. But you definitely need to do both sides, either individually or together. Yeah, exactly. Good. So we've stretched the neck, we've stretched the chest. We're going to stretch the shoulder now. So if you can come back to the center where you were, Tricia, and stand side on just for a second. So the idea with this stretch is to help with that. Remember we looked at the shoulder at the beginning and it was falling to the front. So we're going to try and reposition it and stretch it to loosen it out and to help it relax and be able to stay in the position that we want it to stay in. So if you put your hand behind your back, Tricia, and then if you just turn around so we can see your back. Yeah, there you go. So you can see that Tricia's arm is across her back and it's the back of her hand that is just into the side of her waist. Perfect. Then if you come back to the side. So what I want you to do is to lift your shoulders slightly toward your ears and then pop it down at the back. So it's like you're lifting it and rotating it to the back. So it's in the position that we want it to be in. And then from there, you're going to take a breath in and you're going to push that shoulder to the back. So it's quite a small movement. You can slightly push the back of your hand into your waist to get it. And just push the shoulder back and feel the stretch come through the front of the shoulder. You might also feel it in the upper arm. Can you feel that, Tricia? Yeah.
Good job. So again, keep the breathing going. And if you want to just relax it off for a minute and then come back into the position. So I'll just show you with me because I'm slightly closer in than Tricia. So I've got my hand behind my back. I've gone from the shoulder being rotated to the front here. I'm lifting it and placing it back down, and then I'm just pushing my hand against my waist to get that push a little bit further to the back, and I'm feeling the stretch all the way through this area here. Let's swap sides, Tricia. So hand behind the back, that's it. Shoulder lifts up and then it goes down to the back. And then when you've got that, you're going to push your hand and use it to sort of lever against to push your shoulder backwards and get the stretch. Good. So we probably won't hold, there's no need for us to hold all of these for 20 to 30 seconds. It probably doesn't make for very good viewing. So, but if you're doing it at home, then please make sure that you do hold it for a decent amount of time so that you get the full impact. Okay, and then the last one we're going to do is a stretch for the thoracic spine. So you'll need a chair for this one, please. That's it. So if you sit on it and sit on it so that you're in a position where you can get your back completely straight. That's it. So you're sitting nice and tall. Imagine somebody's pulling out of the top of your head. You're going to take a breath in, and then you're going to use one hand onto the side of your opposite knee. And as you breathe out, you're going to slightly pull against the knee to twist around. So you'll twist over your left shoulder looking towards the window. So you pull in your, that's it. So the stretch is about the back. So make sure that you're not forcing it through the neck area. So can you feel that in your mid-back, Tricia?
Yeah.
Yeah, perfect. So you're just breathing through. The hand on the knee just helps lever you round a little bit. And as you breathe through, you can just get that little bit further if you want to, but always on an out breath if you're trying to go around a little bit further. And take it gently, see how you feel, and go a bit further if you feel that's appropriate for you. That's it, good. And then come back to the center, sitting nice and tall. Really important on this one not to slump. So breath in and out breath, just gently pulling on the knee to help you get that rotation. Good, perfect. Okay. So those are the stretches for each area that we've described. Let's go on to our strength section. First one we're going to do is for the neck. So you remember with the chin, it was jutting out to the front. We looked at it at the beginning. So we've stretched the back of the neck already, and now what we're going to do is strengthen the muscles that actually hold the head back in the position that we want it to be, which is right on the top of the spine. So if you stand to the side, Tricia, so the action that we want is, it's different to what we did in the stretch. So with the stretch, we drop the chin right down onto the chest. For this one, it's about drawing your chin back and slightly tucking your chin in. So you give yourself a bit of a double chin as you do it. That's it. And then release it off. So you can see Tricia's head is sort of angled forward and her chin sticking out. And as she tucks it in and draws the head back, you'll see the length coming through the back of the neck. So if you hold it back and lengthen. So I would hold about a few seconds, probably about 3 or 4 seconds at the back of the movement to really encourage those muscles to strengthen and to hold your head where we want it to be, and then let it go again and then come back into it. So this is a repetition. This is, we'll do more repetitions than we would say with a stretch. The stretch is about holding and lengthening and breathing, where these stretch exercises are about repeating. Yes, we'll hold for 3 or 4 seconds at the top, but you don't need to hold for a long time. You then come back and then you go again to retract. So this is chin retraction. So we're drawing the chin to the back. Can you feel the difference in that, Tricia, between the stretch that we did, where we had the chin completely nodded to the front and the neck was about as long as we could get it to get the stretch, and this one, where the chin is almost staying parallel with the floor and you're just retracting it? So it's a bit like, I'm sure there's, I can't think of the animal now, I'm sure there's an animal that walks where it kind of, you know, does that in and out, one of the birds, doesn't it, or ducks or something do that.
It's sort of like, does that.
Yeah, exactly. That's exactly the motion. So where we ideally want our head to be is at the back of that movement. So we're just trying to strengthen those muscles to hold it there rather than relaxing the muscles to let it drop to the front. Good, perfect. And even though it's only a small movement, you will feel that those muscles get tired quite quickly if you're accessing the right ones, because they're not used to being in that position and the head's quite heavy. Good. And then relax there. So what would you say about that one, Tricia? What tips can you give on that one? Because it's quite a subtle one.
It is. It's something that I try and practice quite hard when I'm walking. So, you know, if I'm walking down to the shops or something, I'm very conscious of my posture. So, and I'm thinking, you know, shoulders up and down, you know, like that. So pushing your shoulders to the back. And then having done that, I'm thinking about the position of my head, which naturally tends to jump forward because I've got this tendency towards that humpy back. So I'm very, very conscious as I'm walking of pushing my head back, just like I was doing in that movement there. And then trying to walk in that position rather than walking with my head coming forward.
It's yeah, absolutely. It's quite a subtle movement, isn't it? That idea of, you know, keeping the chin parallel with the floor and just retracting it. And I suppose another way to think about it is if your chin is jutting forward, the bit of your head at the top here, the rounded bit of the head at the top, is almost falling to the back a little bit, and this is shortening. So when we retract the chin in, that lifts at the same time. You can also maybe try it on a wall. So if your chin was forward, your head would be away from the wall, and as you draw it in, it would come closer to the wall. Good. All right. So let's go on to strengthen the back and the shoulders. Let's shoulders first, actually, I think we'll do. I'm going to do 2 for the shoulders. So first one, we are going to, you can actually use a little weight for this if you want to, or you can do it without a weight. If you are using the weight, a very, very light one, so ½ kilo or a kilo maximum to start off with. So if you put your elbows into your waist with your palms facing up and have the hands to the front to start off with. So position your shoulders in the right position before you've even started. So you want your shoulders back and down. So your elbows will stay at 90 degrees, and all you're going to do is pivot around your elbows. So you're opening your hands out to the side. That's it. And if you keep the elbows tucked in, you won't be able to go very far out with your hands and then come back to the front. So breathing in and breathing out. That's it. So what you need to watch out for with this is that the movement is coming from behind your shoulder at the back. And make sure that it's not coming from lifting your shoulders up. So there's absolutely no reason for the shoulders to lift towards the ears. It's about getting in behind the back of the arm, really. I don't know if you want to stand on the side for a few, then we can just have a look. So palms stay up all the way around. Elbows stay tucked into the waist, and you're just opening and closing. And you should feel, so what this exercise is trying to do is where the shoulders were inwardly rotating, as we saw at the beginning, we're trying to what's called externally rotate them. In other words, put them round to the back. So these are the rotator cuff muscles, and they help to draw your shoulders round to the back. And you'll also probably feel that the chest is opening. You might even get a bit of a stretch across your chest as you open your hands if you're particularly tight in that area. Good. That's it. So I would say 10 to 12 of these and build up to 2 sets. Good, lovely, and relax. Okay, so you can lose the weights now. So that was the muscles just behind the back of the arm that are responsible for rotating the shoulders to the back. The one that I want to get into now is the muscle right between the shoulder blades, so right in the center of your back between the shoulder blades. Those muscles are known as the rhomboids, and they're responsible for retracting the shoulder blades. So I'm going to show you 2 ways of doing this. Number 1 is to use a wall. So if you can stand towards the wall, Tricia, with your hands at chest height. That's it. Now, this is quite a subtle one as well. And don't forget that part of learning these exercises and kind of making progress is about connecting your mind with your body. And that took you a little while, didn't it, Tricia, to get used to?
Yeah, I couldn't locate these muscles at all to begin with. I just didn't know where they were, and gradually I found them. It's almost like you've got to visualize. So if you know where you're trying to access, if you just keep thinking about that area and visualizing that area, so in this case it's the area right between the shoulder blades and the middle of your back, then with time it will come. It sometimes helps if somebody's there with their finger on the bit in the middle. That can really make a difference. I know that's hard at the moment in the current conditions, but anybody could kind of just point, and it just gives you an area to sort of aim for when you're exercising. So put your hands out at chest height, Tricia. And then what I want you to do is, without moving the arms or even the back, really, the back stays straight. I just want you to think about the bit in between your shoulder blades and try and access that to squeeze your shoulder blades together. So this is one that we won't be able to see on the camera. So we're not bending into the arm, but all you're trying to do is literally just bring your shoulder blades closer together at the back. How can you describe that feeling, Tricia? Well, you often say to me, slide your shoulder blades together. And it is sort of visualizing those that sort of triangular shape of your shoulder blades, the bits that stick out if you're very thin, and just thinking of them sliding towards each other. And it's I presume you're sort of shortening the muscle between the 2 of them, and then the muscle lengthens again. So
yeah, that's exactly it.
Yeah, we sometimes do it on the floor, don't we?
We do it on the floor. The reason why I didn't do it on the floor was partly not to get people moving up and down, but also because I think when you're on the floor, there's more possibility of other bits starting to move, so you can start to bend through the arms and move your back, so you're not isolating those muscles that we're trying to get. Where if you're just here with a straight arm on the wall, you can sort of feel it a little bit better, because all you're doing is moving your shoulder blades closer together. And again, what I do with this is move them together and hold it for 3 or 4 seconds, and then release it off and go again, and work up to about 10 repetitions, I would say. Good, okay, and relax. So I thought, because that is so subtle, that we'd give a second option just in case. And the second option is, if you take your weights again, but people don't have to use them if they don't want to, and stand side on, please, Tricia. Put your arms out at chest height, palms down. Relax your shoulders. So really important when you're doing all of this is to keep an eye on your shoulders, because they will want to creep towards your ears. So for this one, it's exactly the same muscle, and you're thinking about squeezing from in between your shoulder blades as you draw your arms to the back. So I'm just giving this as a second option for those people that really find that other one just too difficult, too subtle to get. But with this, you've got to, again, watch that your shoulders don't lift, and you need to make sure that you are accessing that area in between the shoulder blades. So imagine that your arms won't move unless you've squeezed in between your shoulder blades. So it's like that bit in between your shoulders is pulling your arms to the back. Good. That's it. 2 or 3 more. And you can see that Tricia's arms are on exactly the same level the whole time. Good. Last one then. If your shoulders start to lift, then you'll find that they really ache. So don't forget, keep those away from your ears all the way through. How would you compare those 2 exercises in terms of getting into the bit that we're trying to get into?
I think the first one is better because you can really, if you're moving the right bit, you can really feel it. With that one, I think you're engaging other muscles. So yeah, the first one, when I was against the wall, you've really, to make the movement, you've really got to push that muscle that's between your shoulder blades. You've really got to shorten it and then lengthen it and shorten it and then lengthen it. But it took me a while to get it. So I would say to people, if you're, to anyone watching and trying to do it, if you find it difficult to locate that area, then just keep practicing. Try the one that Lindsay's just recommended there with the weights and pulling back, and you will find it. You will get it. I mean, I did eventually locate it and understand.
It's amazing. I know that I can't be with you anymore, but or at the moment, but it did make a difference at the beginning, didn't it? Where I just put my finger on the bit that you were trying to access. So if there's somebody around that can do that, I think that is quite useful as well.
Yeah, absolutely.
All right, so what we've done with regard to strength so far is we've strengthened those muscles that pull the chin back and help to settle the neck and the head in the position that we want it to be. We've looked at the shoulders and drawing the shoulders back and round, so trying to pull them away from that rounded forward position that we're in. And for our last one, I want to look at the actual back itself. So we've looked so far at strengthening the back of the neck to hold it in the correct position. We've looked at strengthening in between the shoulder blades and behind the arm to try and get the shoulder blades pulled around to the back. And our last exercise of this session is to look at the back itself. So for people that do Pilates, this is a diamond press. So you want to have your fingertips together and your thumbs together, so you create like a diamond shape with your hands, and then you put your forehead onto your fingers. So the whole aim of this exercise is to try and correct that rounded shape with the back, so the forward flexion of the back, and get some extension going through the upper part of the back. So you're going to take a breath in, and on the out breath, you're going to push your hands and your arms into the floor, and you're going to lift your head and shoulders. As you do, you keep the chin nodded. So keep your chin nodded so you've got some nice length through the back. That's it. Good. So can you see how we're getting more towards a kind of scoop shape in the upper back as opposed to the rounded shape that we're normally in? And then release that down, Tricia. Take a breath in. So we're breathing in. And as you breathe out, you push the hands and the arms into the floor. You think, you keep the chin nodded. Yep. You think length out through the top of the head. Draw your shoulders away from your ears and scoop into the upper back. And then release down. So let's do 3 more of these. Take a breath in and lift and lengthen, drawing the shoulder blades down. That's beautiful. And release. 2 more times. Take a breath in and lift and lengthen. Keep the chin nodded. So we've created that lovely length through the back of the neck. So we want to maintain it all the way through. Last go, breathing in, push the hands down. And you might feel that the more you do this within the session, the higher you can get. So you don't want to force it, but the back should, give you a little bit more as you go through. Perfect. How did that feel?
Yeah, that feels like a good stretch.
Good. Okay. So it will be stretching, but it will also be strengthening. So we're asking the muscles to hold the back up in that position, which is it's not used to. So it will be strengthening at the same time. Good. How are you feeling?
Yeah, I feel very like I've had quite a tough workout in that area, I have to say. I think it's because naturally I hold a lot of tension in that area, because we're talking about shoulders and neck and the nature of the work that I do. So I spend a lot of time on the computer writing stuff, and it just it does all get very, very tight, and you can really feel it when you're starting to loosen it off, and then trying to get those muscles stronger. It's quite hard.
It's kind of subtle in some ways, but that doesn't mean to say that it's not challenging. Often the more subtle things are the most challenging. So let's just a couple of quick stretches. So if you clasp your hands and push them away and chin on the chest, I just want to separate the shoulder blades. So we've worked quite a lot around the shoulder blade area. So this one is just going to loosen it off. Make sure you're breathing through as you do it. That's it, perfect. Release the arms down then. Circle off your shoulders. Hopefully they feel a bit looser. And then the other way. Give them a swing through. That's it. And then to finish, just rotating from one side to the other. Nice deep breaths as you do. And then you can settle back in the center and you're all done. Nice work, well done.
Thank you very much indeed, Lindsay. That was wonderful. So got any thoughts about what we're going to do next week?
Core, I think.
Okay,
yeah.
That's good to me. So I shall look forward to seeing you next week, and I shall look forward to seeing everybody else. Do come and join us, and do practice some of these exercises in between the sessions, and I'm sure you're already doing that, and I know some of you are doing it very assiduously, so well done for that, and hopefully you're feeling the benefit, because that's the main idea behind doing everything that we're doing. So thanks again, bye-bye, and see you next week.
Bye-bye.